Hello, welcome in this presentation. Thank you to be here. This is the first masterclass of healing chronic pain, understanding the mind-body connection. My name is Veneziano Alessio. I'm a mind-body therapist, and I'm here so excited to share with you some valuable information that did change my life. I did cure my chronic pain. So I think it's really important for you to be here. It's not a coincidence if you are watching this presentation, and I hope that it will change your life as changed mine. So thank you again, and let's start. Before we start with the topic of chronic pain, I want to introduce myself so we know each other. My name is Alessio Veneziano. I help people resolve their chronic pain through a mind-body therapy. It's a holistic therapy approach. I was suffering, maybe as you that are watching this video, this presentation, or somebody close to you, with chronic pain. And I had neck pain and upper leg pain for many years, almost 5 years. I tried many solutions: massage therapy, acupuncture, osteopathy, yoga, physiotherapy. All of these therapies are really good for short term, but it didn't solve my problems. So that's why I'm here, so passionate to share this with you, because there are solutions. And my solution was into a mind-body approach. So targeting the mind was the solution of my therapy, of my conditions. I do share this online through my website, but I also have my private practice in the Netherlands, where I'm actually based at the moment, in Groningen, the north of Holland, the Netherlands. My intention today with this video is to, again, give some hope to people that are suffering from chronic pain. They didn't find any solution. They tried many therapies and the pain comes back. They are spending a lot of money to try and suffering. So this is my intention, to give you some valuable solution that did solve my problems, and maybe I will solve yours. I want to continue asking you two questions, two important questions. Have you ever considered that your repressed emotion can be the cause of your chronic pain? Or have you ever considered that the root cause of your pain was in the mind instead of your body? And an additional question: how many times have you treated your body instead of treating your mind? Okay, in this masterclass you are going to learn what is chronic pain, how it works, some scientific studies that you need to know to understand a mind-body approach, and the solution that you have to cure your chronic pain. Okay, in these two slides you see two books that I've been reading that did change my perception, my belief of chronic pain, and it did help me a lot to heal my chronic pain. So what is sharing here Dr. Sarno, that was a medical doctor of a rehab center in New York, has been working for 50 years sharing this knowledge through other professionals and patients. In the beginning he was treating the patients in a very conventional way, but he didn't find any success, or barely any success. So he wanted to, it started to see that by knowing these patients, most of them, 80% of them, had also some stress in their life, which most of us has, right? But by treating the stress, by treating their mind or also unconscious stress, these patients were getting better. And in those days, in 1960, there were not so many studies about this, but nowadays we have. So that's why it's really important for you to understand this and to let apart what you already know and be open for something that is new. Then after you find out that there are some science behind, then maybe you're going to believe it, and then the healing will start, as it started for me. Okay, it's important to know what Dr. Sarno found with his thousands of patients. Okay, 80% of the time, actually, more than 80% of his patients were coming with pain that wasn't from serious pathologies. Means there were no fracture, no infection, no tumor or cancer. If pain is coming from these three, it's a different story. Okay, so please check with your doctor that you don't have these three. Symptoms were in the body, so they actually felt, and you feel the body with pain, of course. And however, the source is not there. The source was in the mind, and of course you find out this later, not in the first time. Local structures were normal, so whatever they find out in the MRI scan wasn't a fracture, wasn't an infection, it wasn't a tumor. So structures were normal. Then we're going to understand this more in the next slides. Pain was totally reversible, so people were getting cured totally. You're going to find out maybe in the next slides, or also in maybe articles that you're going to read in the internet if you want to do your research. This type of pain is also called neuroplastic tension myositis syndrome or mind-body syndrome, which is a type of chronic pain that is not coming from serious pathologies. Okay, so let's describe what is a neuroplastic pain. I'm not going too much in details here, but this is the basic, okay? And maybe you're going already to relate with this, with your pain. Let's take my example. It was true, was real. So I had the pain on my neck that it was more than 3 months, okay? It was almost, actually 5 years almost. I didn't know where it was localized because it was spreading towards my shoulder, towards my back, okay? It was gradual, it was fluctuating during the day. It was coming up or coming down. It was really depending about the stressful times that I had, maybe during the office, maybe in relationships. And after holidays, or before holiday, it was changing because of course stress is changing. And for example, today I had a patient that was coming after holidays, and he said his neck pain was much better. It makes sense, right? Local tissue is normal, okay? I had few MRI scans, few checks, few echographies on my neck, and there really wasn't really nothing serious, but I didn't know at that time. Pain changes during certain movements, so every time I was doing a left or a right movement, it was changing. And we know that the brain can predict pain, so it makes sense. And you see, actually, the 80% of the pain, the 80% of the people having pain have neuroplastic pain. Okay, we are going further deep into the topic, and I want to show you 3 studies here. So please pay attention about these 3, because this is the foundation of mind-body approach. Okay, so if you understand these 3 studies, everything will be easier. Okay, so why I want to show these 3 studies about MRI scan is because some patients, they think that they also have, they think that their spine is the cause of the pain. They think that there may be hernias or some problems on the discs is the source of the pain, which is not. But let's go now in the first study. 2018 in Poland, okay, 200 patients. They scan their spine, they take a picture of their spine, and they find no correlation with pain intensity and the MRI scan. So what does this mean? Pain intensity means that from 0 to 10, I ask you how much pain you have. 0 is nothing, 10 is a lot, I can't move. Then you have 8, okay? Let's say you have 8, and they scan they take a picture of your spine, and they find out that your 8 is not related to a really bad spine, okay? Because another person maybe have 1 or 2 have worse conditions, have a spine that is in worse condition than you, okay? But what they found out, that actually the MRI scan was more related to age and BMI, means that the aging process, more old you are or more fat you have in your body, and more damage you have in your spine, which again is not related to pain. Okay, second study, again MRI scan, okay, picture of your lumbar spine with people here without back pain, 1994 in USA. So the picture was from 98 patients with no back pain. Only 36% had a normal spine. The rest show abnormalities. Okay, so this means that these people with no back pain had an abnormal spine. Okay, so we can say that if you have a herniated disc, you have pain. I hope this is clear at the moment. Last study, same thing, year 2015. This time the picture, they took it on the cervical spine, so on the neck, okay? 1,211 patients, was a pretty big group. They had no pain, so asymptomatic also called. Only 13% had a normal spine, 13%. So 5 of these 80% almost of people with an abnormal spine also had a spinal cord compression, which is kind of scary, right? But again, we can say here that it doesn't matter what you find out in your spine, it doesn't mean that you need to have pain, okay? Unfortunately, this is not clear for some doctors still, and it's really dangerous for the belief of what you believe of you have in your spine. So, conclusions of the studies. It's normal to have an abnormal spine, so don't blame your spine because you have pain, okay? Because this is not true. We see in these 3 studies, and you can search by yourself and you will find out that there are many other studies. So if you have an abnormal spine, does not mean that the pain is caused from that. So you may ask, where is coming my pain then? That's a good question. Dr. Sarno, in his career, find out that repressed unconscious emotions, they call also rage, was the source. Also fear or emotional stress was the source, which is kind of the same things. Okay, so let's talk about how neuroplastic pain works in your body. This is kind of the physiology of the pain, if you really want to know how this works and why it's coming from the mind instead of your body. So this is Sarno theory. Nowadays we know that this is based on science, okay? Tension on your unconscious mind, so something that you don't even are aware of. So thoughts, worries, they are always in your mind that you don't even know that you have, because something may be coming from the past, maybe years ago, okay? So tension that will be in the brain will spread these signals of your nervous systems around your body. And we know that your nerves are spreading from your spine, okay? That's why most of our problems are related to the spine. So it's going to be activated. So signals are coming from your brain, going to the area of pain. Let's say that you have pain on your neck, and these signals are firing towards your neck. We know that we have evidence also about this, that a vasoconstriction is happening in the area of the pain. This means that your vessels, where the blood is flowing, are going to constrict. And if they are going to constrict, less oxygen is carried out, okay? So less oxygen, less food for the cells, more toxins are building in the area, and then results in pain. Okay, so we are arrived in a very crucial point. If you understand this, then you understand the mind-body syndrome, or the mind-body connection really well. So we know that the source of the pain is coming from our unconscious mind, okay? And our unconscious mind is here below, okay? But how you get to the unconscious mind? You get to unconscious mind by the conscious mind, okay? You are aware of now at the moment that you have stress, but you repress it. You don't express it somehow. You don't talk about it, don't give some voice about, okay? And then from there you are pushing it inside, and it's going to go into the unconscious mind. And all these are the source of hunger, the source of the rage, the source of your pain. You see on the left personality traits, okay? Let's make an example. You're a people pleaser. I'm also used to be a people pleaser. Always say yes, yes, yes. I help you, I help you, I help you. Alright? Or maybe you have low self-esteem. Or maybe you are a perfectionist, which I used to be, at the same time I am also a perfectionist. So you are blaming yourself for everything that is happening. Maybe you are making a mistake, you're blaming yourself to make a mistake. Other stressors. Example, you break out your relationships. Okay? This is going to be a stressful moment that from the conscience, of course in the moment, was important, and then is repressed into your body. Childhood traumas. Some of us has childhood traumas, or stressful events, for me was, for example, that I wanted to become a sport professional, and I couldn't do it because of my injury, and I repressed that emotions into me, causing pain on my upper leg. Okay, but this was my experience. So I'm not going to details here because it's already 20 minutes, so I want to make this short. So if you have more questions, you can still answer by I can still answer it by emails or by my contacts that you will find in the end of the presentation. So these two together, conscious and unconscious, are working to make physical symptoms on your body. If the unconscious mind, if you don't give voice to the unconscious mind, or you don't at least pay attention that you have it, okay, that there is something, and just to pay attention that there is something is a kind of giving voice. So what is happening here, that your conscious mind, it cannot express anymore, and it's going to express to physical symptoms instead of going to your mind, because it's the body and the mind actually is amazing how it works. Your mind is trying to protect itself, so it doesn't want things going on the conscious, so it's going to repress into the body. So I wanted to pay more attention here in this slide, because this is really crucial to understand. Okay, so I hope it was clear. Okay, so in this list you're going to see the equivalence, means the same things, the same mechanism that you've seen before with chronic pain, neuroplastic pain, is working for asthma, allergies, acid reflux, skin condition, headaches, anxiety, fibromyalgia. Okay, here is a bit more tricky, so I'm not going to go into deep into this because it's not my my level of expertise, okay? But I can say for experience that psoriasis for me, it was curing also because treating the mind. Okay, I still have sometimes psoriasis. It goes up and down, but I know where it's coming from. I'm not worried about it. Okay, I know that it's getting better if I treat my mind better. And I had headache and migraines nowadays that I actually cure with nutrition. Okay, so I'm not saying everything is actually coming from the mind, but I'm sure that if you have tried many things, already nutrition and yoga and exercises, and then the things are not going better, then the mind, there's a high chance that the root of the problem is there. Okay guys, this is really important. I know that I always say that, and I've said that before, but please, if you are also going to understand this study, which was mind-blowing when I read it, if you understand this, you understand why mind-body therapy works, and we have studies like this showing that works. Okay, so USA 2021, 4 weeks of therapy, pain reprocessing therapy, it was the first group. So they split these 150 patients in 3 groups, you see down here. So the first group was 50 patients. They cured this 66% of the first group with mind-body therapy, which is a pain reprocessing therapy here called. It's a combination of mindfulness and body awareness and emotional expression. I'm not going to talk too much in details in this slide now, but they did use a mind-body approach. Okay, 66% cured. This means that the pain was 0 or 1. Alright, and this is already incredible, because in 4 weeks it's very short time. So, and the other group, 51 patients with placebo, this means that whatever they say to the patient, if you say to you, you're going to get better, you do this, okay, there was no pain reprocessing therapy here, but they just use the placebo. So whatever I say to you, you believe it, and it's going to be true. But 20% they got better, which is already remarkable, right? And in the usual care, in 4 weeks, which is really little, they had chronic pain patients for maybe years of having this pain. 10% they got cured, which is not so much, right? 1 out of 10. So 5 patients were cured here. Another remarkable point, and I don't know if you're seeing that in these 150 patients, all presented spinal abnormalities. This means that they had maybe hernias or something like that. So if you are still one of them that thinks that your hernia is causing your pain, look at this study and think about it, okay? Another thing that maybe I didn't say, is that in pain reprocessing therapy there is also pain education, okay? So they said to the patients the same things that I will say to you in my program. There's already said to you in these slides, but much more in details. So we spent like here so far 27 minutes. I'm not even close to the total things I wanted to say, but it's a masterclass, so I hope at this moment you have more information about chronic pain and the solutions. So to wrap up, recognize the process of mind-body connection to pain. This is crucial, guys. If you recognize these things that I told you, you think about them, you process about them, this is crucial for the cure. So the point here is not to avoid stress, but how you react to it. Everybody has stress. I still have stress. I still have sometimes pain. I know where it's coming from, right? So it's manageable. And once you know, the body is kind of expressing it as well, because you kind of giving a voice. Prevent symptoms and illness in the future. So this is not just good for your chronic pain, it is good for many other pathologies as well. But I didn't really wanted to go into other things. I don't want to make things complicated here. But mind-body approaches can cure many conditions that I already listed before. Okay, finally we arrived at the solution. So after all these slides, what you can do to get better. Step 1, mindset and knowledge. You need to understand what was already said in the slides, maybe also more in details, okay? And then you need to repudiate the physical explanation of what they told you, because if you have pain and you believe that you have pain from your back caused by hernias, for example, then it's not gonna work. It's not gonna work, because we have the studies showing that this is not the truth. So you need to accept this and believe it. So I advise you strongly to read Sarno books, and then also research for yourself. Research the studies, see if they are actually true, if they are there. You don't have to believe me at the moment, because it's good to be skeptical, and I was also skeptical. and I did get better already from the first step. Step 2, if you want to get deep into the unconscious, I have to say here, you don't need to change your unconscious to get better. You just need to, in the beginning, to understand that there is something there causing the pain. Alright? Then, of course, you can also change the unconscious with some work. Okay? But for most of people, we saw that step 1 was already enough. Step 2, write to unlock the unconscious. So there are exercises to do here. Reflect on issues and symptoms. Reprogram the mind to decrease triggers and symptoms. And these exercises are going to be done by my help. If you write me an email, so then I know that you need assistance. And in the future, in the few weeks, hopefully, I'm going to make some programs about it online, so you can also follow those. But at the moment, at the moment that I'm doing this video, you can find me by email or website. So the step 3, maintenance. Rebuild your life with activities and purpose and lifestyle. This is about you. Okay, you have been doing already step 1 and step 2. You've already been doing a lot. What you need to do now is maintenance. Okay, lifestyle is really important. We know, we don't need to explain it here. So yeah, at this point we are actually done with the masterclass. I hope it was really interesting for you. I hope there wasn't something that you knew already. Okay, and if you knew already, it's good to know that there are some other people that are acknowledging this. Okay, so we are in the end of the presentation. I really thank you for being here, and really blessed and happy to share this with you. This work was really valuable for me, and it did change my life, my career, into what I do to help people with chronic pain. I hope it will help you as well. I know that there was a lot of information, maybe not easy to understand and not easy to believe, but please do your research, and you don't have anything to lose, right? You have been already doing probably a lot of therapies, and you don't want to live with this pain all your life, because there are solutions. Why then don't try them, right? So again, thank you, good luck for your research, and if you find that you need some help, some guidance, feel free to reach me through my website, which is venezianotherapy.com. You see all the details, you send me an email, and yeah, I wish you the best, and thank you again. Bye bye.